Hey guys, welcome to Prep Medic. This video is a little bit different. It's not super long, but I want to talk about two things you can do to save lives without spending literally any money. The more I realize that so much content is focused around products, right? I do a ton of product reviews because they're easy videos. They don't require me to do any kind of research. I can kind of go through it, give my professional opinions, and move on. And I do like gear, right? I like carrying equipment. I like, having my, ankle IFAK and having crap in my backpack and all of that. But I think one of the big things that's missed here is the fact that my like for gear and what I carry was largely informed off of my education, right? I went to school for a relatively long time to do what I do, and I have a lot of real world experience. So I really want to talk about what you can do with nothing. There are a lot of economically disadvantaged people right now. We have crazy inflation, groceries are crazy expensive, and I'm here on the internet saying you have to go buy, a $50 thing of quick clot gauze, or you have to go get this $30 tourniquet, and you have to figure out how you're going to carry it, probably, buy some kind of in the waistband IFAK. And the reality is a lot of people aren't going to do that because it's not feasible. If it's a choice between, first aid supplies that you'll probably never use in your life or feeding your family, I hope every single person watching this video is going to choose feeding your family. That is so much more important. And what I really, really want to drive home here is that you don't need to spend money to save somebody's life and be prepared. YouTube and the internet in general is a great resource for really good education, and it really all just comes down to education. So what are the two things you need to know how to do that are going to help the people around you or have the highest likelihood of saving somebody's life? The first one is how to stuff your t-shirt into a wound. We talk a lot about wound packing, and we usually talk about it of like junctional sites, so base of the neck, armpit, and groin. And that is where we traditionally pack wounds, whereas we tourniquet everything else on the extremity if we have a commercial tourniquet available. I'm here to tell you that while that is best practice, you can stuff any wound that is on the extremity or in a junctional site. So if you come across somebody and they have a cavitated injury on their arm, you can take your t-shirt and you can shove it into that wound and you can pack that wound effectively. Will it be as good as having a commercial tourniquet? No, it's not going to be as effective. You have a higher failure rate, but that will help that person tremendously. So the other thing you should know how to do is hands-only CPR. The survival rates between 30 compressions and 2 rescue breaths and just somebody doing CPR on a patient are negligible. There's not a huge difference in survival. So I really like that skill because it doesn't involve rescue breaths. So you don't have to French kiss that dude you've never met on the ground to save their life. You can just press on their chest until helpers arrive. Now, let's talk about how to do both of these procedures because that's super important. And you don't need anything fancy. This is something you should practice hands-on. I'm not saying that internet is the be-all, end-all and that you shouldn't get some real-world experience. But if that's not feasible for you, this is a close second. So when we have a patient that's bleeding profusely, so this is going to be a patient that has blood pooling under them. This is spurting blood out of the junctional sites. This is soaking through multiple layers of clothes. The most likely scenario here is going to be a stab wound or a gunshot wound, but you can have somebody slice themselves on a chainsaw, on plate glass window. I've seen a lot of traumatic amputations from motorcycle riding. Essentially, what we're going to do is we're going to provide direct pressure over that artery. In a lot of cases, just putting the pressure over the arm isn't going to be enough because you still have soft tissue under there. You've got a cavitated wound, and it's just going to continue to bleed into that cavitated wound. It's going to fill the tissue space. It's going to start leaking out from your hands where you're applying direct pressure. So we really do need to get it down into the wound. In this case, we're going to take our t-shirt. We don't even have to cut it up. We can just take our t-shirt off and we can just start shoving it into the wound. Now, in one of my bleeding control videos, I talk about finding the artery. You don't have to find exactly where it's coming from, but like let's say there's a laceration, it's probably only going to be bleeding from 1 or 2 spots in there. And we want to find where the blood flow is the strongest. We can do a quick blood sweep to kind of get the excess blood out of the way, find where it's bleeding, and we're going to take that t-shirt, ball it up a little bit, and we're going to shove it as hard as we can against that artery. I, of course, have some footage of packing with gauze here for a demonstration. And as we do that, we're just going to go finger over finger into the wound, keeping that consistent pressure over it so that we're not ever like releasing it and letting it bleed some more. Once we have that wound packed as much as we can, we're just going to take that and we're going to hold direct pressure for as long as we can. This is not something we're going to hold it for 2 minutes, check to see if it's still bleeding. We're just going to push down with all our might, use your body weight to get that to stop bleeding. And then when EMS or somebody else arrives, you can hand that over to them, but make sure they understand that they're holding really, really tight direct pressure over that wound. This is an incredibly painful procedure, so you do want to continue to talk to your patients, but it is life-saving and it's a great skill to know. And once again, you just do it with your t-shirt. So the next thing we're going to talk about is hands-only CPR and exactly how to do that. In this case, the first thing we're going to do is expose their chest. Now, scary statistic, men are far more likely to receive bystander CPR than women. There's a lot of misconceptions about propriety in these situations. You can definitely do compressions over the clothes, but it is best practice to do it skin to skin. It just gives you a better feeling of the compression and your correct depth. So in this case, we're going to go essentially nipple line. So the center of the sternum, which is your breastbone right here, we're going to take our hands and we're going to intertwine them just like this. So I take one hand here and I kind of pull back my fingers because we're going to want to compress mainly with the palm of our hands. I like to take my hands and I like to lock my arms over the patient because that allows me to get my body weight behind them. If they're in a bed or they're on a soft surface, let's try to move them to the floor, because if they're on a soft surface, when I compress down, that soft surface is going to absorb their body going backwards and we're not going to get the effective compression. So in this case, we're going to go take that down and we're going to start compressing at a rate of no less than 100 compressions a minute, no more than 110 or 120 compressions a minute. So in this case, great songs to sing in your head. If you're an optimist, it's going to be Staying Alive. If you're a pessimist, it's going to be Another One Bites the Dust. Probably don't sing either one out loud, but both of those will have a cadence that will allow you to keep on track with your compressions. When we go down, we want to compress about 1/3 of the chest. This is a long ways, and the first several compressions, you are going to separate the sternum from the rib cage. It feels relatively gross. I am here to tell you that while that is painful, it is an injury they will have to deal with if they survive the encounter, the long-term implications of that are almost nothing. So like, let's say you accidentally did CPR on somebody that wasn't in cardiac arrest, they had like a prolonged syncopal episode, and you do that, they are not going to die because of that. They're not going to have to undergo crazy procedures. It's just going to hurt for a couple weeks as they heal up. So I hope that is some solace to you. So identifying somebody in cardiac arrest. Honestly, I will show you guys how to take a carotid pulse, but that's not really part of bystander CPR anymore. If we see somebody go down in front of us, they are unresponsive. So that's going to be, rubbing their chest just like this with your knuckles, trying to elicit pain, saying, "Sir, sir, ma'am, ma'am, are you okay?" If they don't respond to you and you look at them, you're going to look at their chest, you're going to listen, and you're going to see if they are breathing effectively. If they're taking breaths, we don't need to start CPR. But if they don't have effective respiration, so they're gasping or they're not breathing at all, we're going to start CPR. Now, if you want to, while you are looking at the chest listening for breathing, also check for a pulse. You definitely can. You can take that and you can check the carotid pulse. So it's either to the right or the left of the trachea right here. We don't want to take both at the same time. We just want to do one or the other because we don't want to compress all blood flow to the head if they do have a pulse after all. And we're going to take these two fingers. We don't want to do our thumb. We're going to compress it until we feel the pulse. Now you can practice this on your significant other, your kids, pretty much anybody you can practice this on if they're alive and start getting good at feeling that pulse. Now what I'll tell you is that it's really easy to get sucked into this phase of, oh, I don't know, maybe I felt a pulse, maybe I didn't. If you're not sure and it's been more than 10 seconds, just stop and start CPR. If you're unsure, start CPR. It's literally as simple as that. Now, of course, in any of these scenarios, you want to get helpers coming to you, so call 911, start those emergency services early. The education and your ability to perform in these situations isn't just limited to these two scenarios. I chose these two things, bleeding control and CPR, because they're the biggest preventable causes of death out there pretty much in the world. However, you can have people with diabetic emergencies. I just did a video of that. You don't need to carry a glucometer. If you see an unresponsive patient that has a medical alert bracelet and they're a diabetic, you can learn how to give them their glucagon or a little bit of sugar there. You know, same with things like martial arts and self-defense, is that's going to allow you to intervene in a lot of different situations. So while gear makes this easier, right? It's way easier if I have a tourniquet, I can throw that on instead of packing an arterial hemorrhage on the extremity. Gear isn't everything. You can do a lot of this just, you know, with knowledge in your head and a body that's able to perform these procedures. So if you have any questions, leave them in the comments down below. If you have any like topics that you believe others could learn that are going to greatly better society and the people around them, also leave that down there. I'm kind of curious to see what you guys come up with. But I hope you like this video, and I will see you next week.